Hello, my name is Chloe Yu, and today I am presenting a topic on telehealth in nursing. This presentation will cover the background information of telehealth, examine various studies that support the use of telehealth as an evidence-based practice. Next, I will discuss how telehealth is currently being employed today and what the research predicts to further expand in the future practice. And lastly, uncover the importance of the role of DNP nurses in our upcoming practice. When we first think of telehealth, the first image that comes to mind is the virtual clinic that was widely used during the spread of COVID-19 pandemic. The general public may perceive telehealth as new emerging technological portal for patients to access physicians and receive treatment. However, telehealth operation was first taking place in Birmingham, Alabama in the 1950s. Due to a lack of funding and financial support, the use of telehealth was not publicly known until the recent outbreak of COVID-19, in which many of the things that we traditionally conducted in person have moved to virtual worlds. Working from home, attending schools from home, and shopping from home are all relatively recent occurrences for the majority of individuals. Telehealth is also known as telemedicine, which is defined as the use of electronic information and telecommunication technologies to support long distance clinical healthcare patients and professional health related education, public health, and health administration. It has been proven to reduce barriers to healthcare such as cost, transportation, long wait times at clinics, and disease transmissions. The act extends further to patients who are unable to leave their homes if they're immunocompromised and or immobile. Leading professional organizations in nursing have acknowledged that telehealth needs to be part of advanced practice nursing programs. It is even included in our AACN Essential of Doctoral Education for Advanced Nursing Practice Handbook, which promotes patient care technology being incorporated within the curriculum. A study shows that less than one-third of the program from 206 higher education nursing school prepare and educate students about telehealth. And the DNP students who learn telehealth from online when compared to face-to-face learning, students who use online learning modules report higher class engagement and satisfaction, a better understanding of the course material, and higher grades. Therefore, we should take this presentation into careful consideration and explore how this is beneficial to all involved stakeholders. There are numerous studies that support the intervention of telehealth in our current healthcare field. In a systematic review and meta-analysis article, examined the effectiveness of telehealth interventions on persons with dementia and their caregivers and family members. In comparison with routine or usual care, the telehealth intervention resulted a significant benefit for persons with dementia when it came to depressive symptoms, as well as for caregivers when asked about their perceived competence. In addition, the researchers add that telehealth interventions show great promise as efficient, cost-effective, and accessible strategies, which corresponds to past findings that telehealth appears to positively influence not only persons with dementia, but also a wide range of other populations, such as stroke survivors, heart failures, or other cardiovascular disease, adolescent sexual health, and HIV/AIDS survivors. In another systematic review, study suggests that through telehealth services in rural areas revealed high patient satisfaction for occupational therapy, physical therapy or physiotherapy, and speech language therapy. The reasoning is related to ease of travel, quality of care, safety, and reduced cost. Telehealth service delivers therapy to clients in rural settings that have difficulty accessing healthcare services. And now let's talk about current practice of telehealth and how this will project into the future. From 2010 to 2017, the number of people using and putting telehealth into place grew by a lot. And in 2010, only 35% of the hospitals had some kind of telehealth system in place. By 2017, 76% of the hospital had either put computerized telehealth into place in full or in part. Telehealth technology today has also been very helpful for providers. Studies suggest that between 50 and 75 times as many people used telehealth during COVID-19 pandemic as they did before. More than half the providers have also said that they feel better about using it and have a better opinion of it now than before the pandemic. As technology advances, we're expected to transition our patient care into virtual world. There are new services already put into practice, and here are the examples of new programs from Keystone Healthcare. Telehealth, Tele-EMS, which is an innovative platform that connects emergency department providers on demand or with local EMS or mobile urgent care providers. The goal of this program is to use technology to triage, treat, and transport patients to the emergency room or to another place in the hospital. The Virtual Case Management and Utilization Review is a program that gives providers real-time access to virtual case managers. They can assist emergency providers with their inpatient admissions and ensure documentation and status is appropriate at the time of admissions from the emergency department. Another program includes ED to Home, which is a direct-to-consumer platform which allows patients to virtually connect the emergency department providers from the comfort of their home. This is aimed at providing a seamless transition from home to the emergency department when needed. And lastly, I want to talk about how DNP can impact the community and how our role is relevant in today's practice. Telehealth is a useful tool that we can use in our practice now or in the future. Using technology like video conferencing, remote monitoring, and mobile health apps, telehealth lets people get Medicare without having to go to the doctor's office. DNP can use telehealth to improve access to care for patients who may have trouble getting to physical hospital or offices to get the care they need. This could be because they live in a rural area, have trouble moving around, or a busy schedule. This can also help lower healthcare costs because patients might not have to travel as far as to their appointment and can get care more quickly. As a DNP, you can use telehealth to improve patient outcomes by getting patients more involved and educating them. Patients may be more likely to participate in their own care when they have access to telehealth tools that makes it easier to communicate with their healthcare providers and track their health status. It allows for more frequent monitoring and follow-up with patients, which can improve outcomes for those with chronic conditions. And in summary, telehealth and mobile health applications are valuable tools for DNP as they can improve access to care, reduce healthcare costs, and enhance patient outcomes. Our role is not limited to just leadership in patient or outpatient setting, but is expanded across all career fields, such as ambulatory care, primary specialty care offices, in schools, jails, federally qualified health care centers, in military fields as home health nurse, in hospice or in palliative care nurses through virtual consultation and through management. It is important for DAPs to stay up to date with emerging technologies and evidence-based practices to effectively integrate these tools into our practice. Thank you for listening, and this is Chloe Yu.